So, good afternoon, doctors. It's our absolute pleasure to welcome each of you to this insightful webinar. So, we are honored to have such a distinguished gathering of medical professionals here today. So, before we start today's session, allow me to introduce our company, Hetero Healthcare. Hetero Healthcare is determined to stay a step ahead to deliver superior and innovative care. Hetero Healthcare has established 300 products in portfolio and are pioneering in quality and innovation. We have also launched 4 biosimilar products within 5 years in the market and have strong global presence in over 126 countries. So the topic of today's webinar is enzymatic preparations with papain advantage in dentistry. To shed the light on this topic, we are privileged to have Dr. Satish Kumar Menon with us. Welcome, Doctor. Dr. Satish Kumar Menon is MDS in periodontics with 10 plus years of experience. He is the founder of Kaizen Dental and practices exclusively in periodontology and implant dentistry in Navi Mumbai. He has also published various papers in the field of periodentistry. He also has a YouTube channel with 54,000 subscribers and Instagram page of 19,000 followers. He has also written books namely BDS Launchpad and Dental Launchpad. Let me welcome Dr. Menon for this session. So Dr. Menon, you can please start the session.
Thank you. It's amazing to see a crowd of people gathering on an afternoon. It's raining out here. I'll just start with my presentation. Just give me a second. Yeah, could you see my presentation? Is my presentation visible?
It's visible, yeah.
Yeah. So welcome all of you all to another session on where we're going to talk about why we should prescribe enzymes and how it is helpful. But before we start with the prescription and everything, we need to ask ourselves, why are we here? Why are the young dentists taking off time and listening to such a session? Why do seniors who have been practicing for years attending continuing dental education programs still? The reason might absolutely vary when you ask each one of them. Some might say, I want to learn new stuff so that I can get more patients. Others might say, I want to do more treatments so that at the end of the day, I can earn more and provide more for my family and society. Whereas there'll be others who would talk about gaining satisfaction and respect as they treat their patients better and treat more number of patients. But the crux of all of this is, how does this matter? All these can happen only and only if we have happy patients. Now, this is our perspective that we want happy patients. But have you ever wondered, what do patients actually want? There might be an old uncle who walks into your practice who would be 60 or 70 years old, just retired and looking forward to a better dentition. There might be a young IT professional who might walk in, or there might be this afraid little small girl who might walk into your practice. What do they actually want? One answer, which we usually tell when someone asks us what our patients want, is they want discounts, they want cheaper treatment. Correct? But I want to ask you a question. Are there clinics you are aware of who are charging usually more than what the average is around them? And they're doing well. They're completely booked and have patients waiting for their appointments? On the other hand, are you aware of those practices where the rates are low, but still the dentists are finding it difficult to find patients? I'm sure you have heard of both these type of practices. So is it always about the cost? Is it always about the discount? Absolutely not. Sometimes we assume that if we can get the best treatment to our patients, they will be absolutely satisfied. But haven't you seen that X-ray of a root canal which might have been 3-4 mm short, done 10 years ago by some other dentist, and the patient is absolutely happy and painless? On the other hand, you might end up doing a root canal, perfect at the root tip, and the patient might complain of pain. So is it what the radiographs tell us what is good treatment exactly? Is that what patients want? No. Patients want basically three things. First is function. They should be able to chew properly. They should be able to eat what they want, when they want, how they want. Second, it's aesthetics. It should look pleasant. It should look nice. It should not look out of the way. It shouldn't feel artificial. If they want it white, it should be bright and shiny. Others want it in natural colors. The definition of aesthetic might vary from patient to patient. But there is one thing which all patients agree on. That is, they want the treatment to be less painful and less discomforting. That is not just during the procedure, but even after the procedure. So it is our responsibility as dentists to try and provide them the combination of these three things. And less pain and less discomfort is the primary source of why patients are scared of dentists. So if you can reduce the pain and discomfort, that fear of entering a dentist's office would automatically reduce in the patient's mind, and you will end up getting more patients and happier patients. Now, one way in which you can reduce the discomfort or pain of the patient is by using medications. And we know that we have been using these sorts of medications since long. Even before dentistry started, normal medicines were prescribed for pain, for all sorts of problems patients were facing. Now, as dentistry is evolving, we have realized that to control pain, just giving a painkiller might not suffice. Even after a painkiller, the patient tends to complain of swelling, redness, some amount of discomfort. Why does this all happen? It happens because of something known as inflammation. For that, you need to rewind and recap to your books or textbook of physiology, in which you would have understood what inflammation is. It's basically a body response to any trauma that can be physical, chemical, or viral, bacterial, anything of that sorts. Now, how does this inflammation look? There are basically five signs which are known as heat, redness, swelling, pain, and at times loss of function. In dentistry, we do not find a lot of times loss of function unless there is a swelling near the TMJ and the patient is not able to open his mouth. These were initially called as rubor, calor, dolor, and tumor. Later, they added functional acia or loss of function. Now, we as dentists have to try and understand, is this inflammation actually good or bad? For that, we need to know there are two types of inflammation. One is acute and the other is chronic. Acute inflammation is actually a good response by the body to try and prevent further damage from any of these traumas, which might be physical, chemical, bacterial, or otherwise. So it is a body response to prevent further damage. But as a part of the response, there is some amount of discomfort which is felt by the patient. If it is not taken care and the inflammation persists over a period of time, it can lead to chronic inflammation. And most of these long-term diseases which you see are basically chronic inflammatory responses. They can be of cardiovascular diseases, respiratory diseases, and at times even cancer. So our aim as dentists is what basically? To understand what this inflammation is and to see whether we need to stop it, prevent it, or reduce its intensity. So for that, let's understand what inflammation is. Whenever there is an injury in a particular site, the local site gives a particular response. For example, let's take an accident. Imagine there is an accident which happened by the side of the road. The people bystanding there and looking at it observed an accident happened. What do? They might call the ambulance, they might call their police, and some people might call their friends just to come and look at what has happened. Similarly, when this initial injury happens, there are certain cells which are present out there. Now, these cells might have already precursors like a mobile phone, which would directly immediately call all these other inflammatory components to the site. Otherwise, they might create it in that area and then send the signals across to invite the rest of the inflammatory response. Now, for example, when you're seeing in a traffic, there are passerbys in the road who stop and come in to look into the accident. Similarly, you have vascular channels or plasma flowing in the blood vessels. Soon as these initial mediators from the cell inform these plasma cells that there is a trauma out there, these plasma cells enter into the site and they start the cascade which is known as inflammatory response. So we have basically two types of mediators. One is the cell-derived mediators and other is the plasma-derived mediators. In cell-derived, as I told you previously, there are already certain mediators which are available in the cell itself and some are synthesized newly when the trauma occurs. When it comes to plasma derived, there are two types. One is the complement system and second is the factor 12 system. So as dentist, मुझे क्या लेना देना? Why should I know all of this? The point is, we as dentists are dealing with trauma day and day. You'll say, how come I'm dealing with trauma? I am just doing general dentistry. But in general dentistry, don't you see a patient walking in with a trauma, injury, fracture, broken tooth? Forget what the patient walks in with. When you do a small procedure like an incision, or you do an extraction, or you drill for an implant, even the simple process of giving a suture is when we as dentists cause traumatic reaction to that area. So if we are causing a trauma to that patient, we should know how the inflammatory response acts and how we should control it. And if you see all your treatments post-operative, the main discomfort patients have is related to inflammation, that is pain, swelling, redness, and so on. So how do we as dentists try and reduce this so that we end up with happy patients? In a phase of healing, you have the initial clot formation. Can we affect that? By giving a cotton pack or something of that sorts. We want a proper clot formation out there. That is how we work on it. Then comes the inflammatory response, followed by the proliferative and the remodeling phase. As dentists, we do not do a lot of procedures where we affect the outcome when it comes to the proliferative and remodeling phase. So what we are concerned is how to reduce the inflammatory response to reduce the discomfort for our patients. And today's day and age, Etro Healthcare has come up with an enzymatic combination which will help you achieve the same. It's a combination approach using various enzymes which are easily available and helpful to our patients. So let's discuss what does this combination known as TOLIP actually contain. The first enzyme it contains is trypsin. If you remember your physiology class, trypsin is already being produced by the body in the pancreas in the form of trypsinogen. Once it enters into the duodenum through the pancreatic duct, it is broken down into trypsin. Why is this trypsin important? It has certain anti-inflammatory effects, like it reduces vascular permeability. Remember in the start I told you, when there is an accident, people from the road walk into the accident site. This prevents that. It sees that the blood supply is continuously maintained and there is not a lot of oozing of blood into the cell region or into the soft tissue out there. It also ends up reducing pro-inflammatory cytokines like TNF alpha, interleukin 1 and IFN gamma. Trypsin also acts as a fibrinolytic agent. What is fibrinolysis? Remember your initial clot formation? What happens there? It's basically clusters of fibrin and various cells which help form the clot. Once the clot is formed, you want that clot to be eventually slowly and steadily cleared out so that it does not lead to a delayed healing or a swelling out there. For that, fibrinolysis is important. This is where trypsin comes in handy. But when we are prescribing a drug like an enzyme, we should always see whether it is going to be beneficial to our patients. Has this drug been used before or are we experimenting with our patients? Most of us are in clinical practices and we are not keen on experimenting on our patients. So, has trypsin been used before? And the answer is yes. Our MBBS colleagues have been using trypsin to clean wounds and ulcers so that the necrotic tissue grows out from there. Because of its anti-inflammatory and thrombolytic properties, it has already been used in rheumatoid arthritis, diabetic cellulitis, chronic ulcers, and even ocular disorders. So this is an enzyme which we have been using in the medical field. So we shouldn't worry as dentists when we are trying to prescribe it to our patients. Then the second part of this enzymatic combination is bromelain. Now, bromelain is a protein which protein digesting enzyme. So all the clusters which is of proteins which are formed at the inflammatory zone can easily be degraded. It is said to have anti-inflammatory, anti-edematous and anti-thrombotic properties. Now, bromelain in an inflammatory area not just reduces the chemical mediators like prostaglandin 2 and inhibiting bradykinin, it also reduces the immune response by having effects on cytokines like tumor necrosis factor alpha, interleukin 1 beta. It also reduces platelet aggregation that prevents an increase in swelling in that area. Similar to trypsin, we need to know whether bromelain is being used before. And yes, it's a drug which has been used before, not just in acute inflammation, but even in sports injuries. There was a study done which stated that if you give bromelain before a surgery, it helps reduce post surgery inflammation. So, when prescribing this drug, we as dentists need not fear. The third enzyme in the TOLIP combination is rutoside. Now, rutoside is found commonly in majority of plants like apple. It has been used in chronic inflammatory conditions and said to have antibacterial, antidiarrheal, anti-ulcer activity. It, similar to the previous enzymes, also has anti-inflammatory action. How does it act? By inhibiting platelet aggregation, decreasing vascular permeability, similar to what I told at the times of trypsin. It prevents the blood entering into the cellular area and preventing the increase in swelling out there. It improves vascular flow so that whatever debris is collected once the fibrinolytic activity happens, those debris is washed away and cleaned up by the vascular supply out there. It strengthens the capillaries and prevents edema. It also has an antioxidative uh, property. Now, what is antioxidative property? Oxides are particles which are formed which damage the cellular structure out there. So, an antioxidative property is one which prevents this inflammatory damage. Other than this, it also suppresses interleukin 1 beta and tumor necrosis alpha. Again, when it comes to rutoside, has this enzyme been used before? And the answer again is yes. Rutoside has been used in human arthritis and other inflammatory diseases. So it has been a proven enzymatic drug which has been prescribed by our MBBS colleagues. The fourth and the most important enzyme in this combination is papain. From where do you get papain? Papain is derived from papaya. These are basically raw papayas, which when they are still stuck to the tree are cut and a whitish pulp oozes out of it. It is from this pulp that the papain is derived. Papain has been proven to have a variety of anti-inflammatory properties, from strengthening blood vessels, antioxidant properties, reducing inflammatory mediators like histamine and prostaglandins, as well as increasing the microcirculation in that area. Papain has an overall benefit when it comes to the anti-inflammatory response. Now, should we prescribe papain? Again, the question arises. And again, the answer is it has been successfully used whether it is diabetic foot ulcers, leg ulcers, pressure ulcers, and even in burns. It has shown its anti-inflammatory properties have been extremely effective. So why we as dentists should not use such an amazing combination of enzymes? The combination of enzymes works in a synergistic effect. What does synergistic effect mean? I hope you remember your physiology textbooks. When one person in a team works single-handedly, he might take you a distance. But when people together act together, work together, the distance they can go increases. This is what synergistic effect is. It's seen not just in day-to-day life, even in sports. So having a combination of enzymes which works together synergistically to get you the best response is the best combination rather than giving these enzymes individually and separately. And that is where Tolib comes in. Tolib helps in decreasing capillary permeability, decreasing inflammatory response, cleaning up the fibrin deposits, improving blood circulation, healing, and tissue repair, along with strengthening capillary walls. So, giving Tolib is advantageous. And the most important thing we need to remember is it comes from Hetero Healthcare, a company which has proven set of drugs which is being used over ages. So it's not an experimental enzyme or an experimental combination. It is something which is proven from a company which we can trust. Then comes, we have understood the advantages of toilet. But when do I prescribe it? Any place where you're expecting an inflammatory response, you should prescribe Tolib. This can be whether you're doing a normal extraction, whether you're doing a surgical disimpaction, or the patient is coming up with a fractured jaw. It can also be used in cases of oral implants, whether you're doing a single implant or a full full arch implants. In all these cases, we are expecting swelling, pain, and inflammation. That is where the patient has discomfort. During the procedure, since it's done under anesthesia, patient does not feel much. So prescribing these enzymes helps prevent post-operative discomfort and makes the patient feel that the procedure was done painlessly and with good hands. Now, how much is the dosage? The dosage is said to be 2 days or as long as required. We all know majority of our procedures, the inflammation might last 5 to 10 days. So that is the ideal time frame in which you have to prescribe this enzyme combination. That is for twice daily for around 5 to 10 days, depending upon how much inflammation you're expecting in that particular site. But with every medicine we prescribe, there are some side effects. And I hope you remember your pharmacology. The most common side effect of every drug is nausea, vomiting, and diarrhea. This is the same combination of side effects which is seen also with Tolib, but it is extremely rare, and we usually prescribe an antacid along with it whenever we give an antibiotic or a painkiller any which ways. Now, this comes to the safety of Tolib. But is there any case in which I cannot prescribe Tolib? Yes, there is. First, if the patient is either pregnant or lactating, we should avoid it. Second, remember we had spoken that it helps in strengthening the blood vessels, cleaning up the area, removing the clot. So if someone is already on a blood thinner like warfarin, we should avoid giving Tolib. Next, the bromelain component, which is a part of it, should not be mixed with sedative drugs. So if the patient is on a long-term sedative or you're giving a sedative as a part of your procedure, then it is advisable to skip on Tolib. Other than these three conditions, that is blood thinning effects of warfarin, sedative drugs, pregnancy and lactation, Tolib has not shown any major discomfort to the patient. So it is advisable wherever you are feeling the patient might have an inflammatory response and discomfort, prescribe Tolib, because as we spoke in the start, all what we want depends on having happy patients. And what our happy patients want is not just function and aesthetics. They want less pain, not just during the procedure, but less pain and discomfort even after the procedure. And Tolib from Hetero Healthcare can help you with that. So we end the session for now, and any questions we will be willing to take right now.
Participating doctors can ask you a question through message. You can just type in your questions and it will directly reach to Dr. Satish. I guess there's one question I'll read out for Dr. Satish. Just a minute. Gabriel wants to ask if it is safe to give Tolib in pregnancy and systematic debilitating patients.
It is safe to give in systematic debilitating patients, but as I've already mentioned, not to be given in pregnancy and if the patient has blood thinning drugs. So, usually, when you say systematic debilitating, most of these patients are on blood thinners. You have to understand which blood thinner it is. If it is warfarin, please avoid because papain is said to increase the blood thinning effect, which you wouldn't want.
The question has been answered. Any other questions? Doctors, you can type in. If you have any question, you can type in the message box. So question, so we can wind it up. So thank you,
Yes.
Dr. Satish, for such an informative session and putting so much of light on helping us understand Tolip in a better way. Thank you for your time. Thank you, participant, for joining in.